am originally from Haiti. I'm 53 years old. I went to college in Ohio. However, after school, I worked for the Federal Reserve Bank as a supervisor for 15 years, where I retired with them. Went back to school, became a police officer. Spent about 2 years. I believe it wasn't a good call for me. Left this job, went back to school again, became a sonographer. I worked in the hospital for about 7 years as a sonographer, did echocardiogram, worked with cardiologists, helping people. Unfortunately, about 6-7 years down the road, my shoulder went out. I had to get a shoulder surgery. So during that time, I gravitate towards healthcare and as an agent. And to be honest with you, it was the best thing I could have done. When I first started doing this, somebody who was in the business told me, I will always remember that you will never make money in this business because you spend too much time with those people. And I said, that's okay, that's fine. At least I know if I spend 3 hours, 2-3 hours with that person, I know that person knows me, and that person will call me and I will call that person. We have a connection. Always, you treat that person the way you would want to be treated, and I guarantee you that person will one day refer somebody to you. One day, that's how I get my referrals. Most clients I get is their referrals. If you are somebody who is not a people person, that's not for you. I'm sorry, that's not for you. I want to know about the health, because that's number one. Because of my background, again, I'll go out of my way to do education with blood pressure, diabetes. Those are extremely important because those are the two that I see that are so common, and people are falling every day as far as stroke and all that. And I try to educate them, make sure that they take their medication, make sure I order the blood pressure cuff for them. We all have the same qualification, we all have the same tools. The only difference is, in my heart, I know it's the right thing to do. If you need the help, I will give you the help. If you need whatever you need, I'll go, this is the line for the agent, I'll jump over it to help you out. That's to me, that's what makes a difference. Living in Miami, in Broward, I deal with a lot of Haitians, and it's a blessing to know that some people, they come in the United States from the third world country, from, let's say, from the Caribbean, and they did not have the chance to go to school or to learn English or read English. So I became their pathway to helping them. I have made more friends in this business than any other business I've had, and that's what I want. I don't want to, have somebody come in and then you sign here and then I go on, my merry way and that's it. No, that's not what it is about. It's about, caring for one another. I mean, it sounds cliche, but that's what it is. If you put your foot forward and you truly help somebody, that person, you don't have to ask that person, are you going to stay with me? Are you going to sign up with me? You don't have to ask that, because it's automatic. That person most likely will. And if that person doesn't, they'll refer somebody to you. So honestly, this is something that comes natural. That's why I said to somebody, if you're not a people person, this is not for you. Honesty is the best policy. I don't like to lie people because they will find out regardless. A lot of people I come across, I give them information, they call the Social Security and they call me back. It says, you're right. Everything you told me, they told me the same thing. My retention is very, very, very high. And that makes me happy, because if you give the person the right tools, the right plan, and the attention that they need, because they're a human being, they will stay with you. You don't have to beg them, they will stay with you. I noticed that the community in Miami, it's a very small community, however, high blood pressure, diabetes, those two are extremely important. Okay, those two, there's a lot of people with high blood pressure and they fear When they go to the doctor and they give them medication, especially male, they'll tell you they're not going to take the medication because the medication affects them. So a lot of those people, they rely a lot on tea. Now, I have a friend of mine. I went to her house and I said, you have high blood pressure because of the way she eats and she said, yeah, but I take this tea, and she showed me the tea. And I said, you should be going to the doctor, taking your medication. And she said, no, I don't like those things. Those things are... Well, what happened is she was working and then she dropped. She spent a month in a coma. They cut her head twice to relieve the pressure for the blood, and she became paralyzed because of her high blood pressure. I usually take it upon myself. When I go to your house, this is something I will teach you. This is something I'll preach. Whether you want to hear it or not, I'll preach it because I know the Hispanic and Caribbean, they are very high on sodium, very high on, and they work hard worker, very proud, but they don't exercise quite a bit. Okay, so therefore, and they do not take their medication because they don't believe in it. So therefore, that they are very, very at the level where they are going to stroke eventually. They are going to go on dialysis. And when you go to Miami, you see young people walking with a limp. You know what happened. When I go knock on somebody's door, see the wife and where's your husband? He passed away. Last month, I went to 4 funerals, and all 4 funerals had to do with high blood pressure. That struck out the first time, which gives you a percentage of stroking out again. If I put somebody in the plan, the very first thing that I do when that plan becomes effective, through OTC, over-the-counter items, I will get them their blood pressure cuff. And when that blood pressure cuff comes, I'll go to their house and I'll show them how to use it. In this sense, I become an advocate for high blood pressure and diabetic. It's those two are killers. The role that advocate play is they are my backbone somewhat, in a way where if you need something, if you need some help of one way or another on how to carry your business and how to do things like that, they're there for you. They're always there for you.
At Advocate Health Advisors, our mission is simple: to help professional agents serve as trusted, informed, and proactive wellness advisors. We're setting new standards of success through industry-leading programs and innovative client initiatives focused on wellness and prevention. Our dedicated, experienced agent care team and nationwide infrastructure of local market leaders provide the tools, resources, and know-how to help you serve as the agent of the future today. For more information, please call us at 1-800-709-5513. We appreciate your time and interest in Advocate Health Advisors.